Welcome everybody, this is Gary Beck, your naturopath from the Maximum Wellbeing Thyroid Studio. And in the Thyroid Studio today, it's my great pleasure to introduce to you Dr. Darryl Turner.
Thank you for inviting me along, Gary, and I'm very happy to share with your patients some insights into the stress modulators.
And so what Dr. Turner is referring to here is that if I just go back a little step, one of the opportunities that we have is when you come into the Thyroid Studio and we perform the ThyroFlex test, if we determine that there is a significant issue, the next step is for us to actually liaise with one of Dr. Turner's hormone specialists, and we're actually able to hook you up directly with a hormone specialist specifically to put a protocol in place to get you back to feeling 100%. So, and part of that is looking at what Dr. Turner has coined your core hormones. So just tell us a little bit about that, Dr. Turner.
Sure. To balance the thyroid, you have to take all the interacting hormones into consideration. The main ones, there's 18 of them, are the sleep, the adrenals, the iodine, the ACTH, that's the segment between the pituitary and the adrenals, the CoQ10, the thyroid hormones, and what we call a group of little hormones called the stress modulators. And unless we get those all balanced, it's very difficult to treat a patient. A lot of you will only need your thyroid treated, but some of you will have stress or sleep problems that we have to address. Now, and then of course some of you will also need the stress modulators. Now the stress modulators are DHEA, GABA, pregnenolone, activated Bs, and D3K2. So I'll just quickly cover, if you don't mind, Gary, what each of those do.
Yes, please, Dr. Turner, that sounds great. Yep.
Okay. I'll start off with the pregnenolone and the DHEA. Both of these are the response that both these are hormones that actually control your estrogen, progesterone, testosterone, and they interact in a highly effective way with the cortisol. If we find that you're low in one of those hormones, it's usually the DHEA, we give it to you to make the other hormones work. So it's like a precursor hormone. The D3K2, D3 is not a vitamin, it's a hormone. It is actually essential vitamin that you're supposed to obtain from sunshine, but who gets 20 minutes full body exposure every day?
Yeah, people start looking at you if you start taking your clothes off down at the beach in the wrong place at the wrong time. So yeah.
But the D3K2 not only is essential to make the thyroid work, but it's also essential to make the functions in your mitochondria work, which evolves in and around your core hormones. The D3, as you know, is a major immune builder. In other words, we're in COVID times now, and if you think you've been exposed to COVID, we highly recommend you take high doses of D3. It is the immune booster. The K2 in it is what builds your bones strong. So that we do not want anyone to take calcium, but the D3K2 means that the D3 performs a lot better, and it also keeps the calcium inside of your bones. And then we have the activated Bs. This is for your adrenals. These are pre-digested Bs, where you get high performance out of the Bs that we take. In other words, if you take a regular B, most of it goes through the digestive system. This gets straight into your bloodstream, and it is for extreme stress. We think that you're very stressed out, and we do that with a symptom scoring system, and then we give you activated Bs. So that covers those ones, and then we test the speedy neurotransmitters in the ThyroFlex test. If they're slow, we know you have a neurotransmitter problem. But if you cannot tolerate noise, you have a neurotransmitter problem. And we use something called GABA. And the GABA is a neurotransmitter hormone that actually starts to make the information flow in your brain a lot faster, a lot smoother, and you can tolerate noise a lot better. But that's the stress modulators.
Yeah, and it's an interesting aspect, and I think we just need to mention this, Dr. Turner, that when we're testing your thyroid using the ThyroFlex device, and we see a slow neurotransmitter speed, so this is one of the things, there's three main things that we're able to see very clearly. When the neurotransmitter speed is slow, then it's kind of a red flag, isn't it? Because we know that if we have a thyroid dysfunction, or if you have a thyroid dysfunction, you're at least twice as likely to develop some sort of degenerative condition such as Alzheimer's or dementia. Twice as likely. So this is how the thyroid picture relates very clearly to our neurotransmitter speed and the potential risks of not addressing that over time.
That is correct. So basically, what Gary is saying is that we can halve your chance of getting Alzheimer's. I haven't had any patients who've told me they want to get Alzheimer's yet, but if we put you onto the right combination of treatment, we halve your chance of getting Alzheimer's. And that's a well-documented research paper out of Scandinavia that documented the connection with thyroid disorders and Alzheimer's. We don't know what causes the other 50%, but we do know what causes at least half of them.
Mm-hmm. And we certainly know that there's far too much of this happening in our current society. So I wonder, underlying all that, Dr. Turner, how much of that with our elderly suffering in some sort of Alzheimer's dementia state, underlying that has been an undiagnosed thyroid problem, perhaps right through their life.
Yes. In fact, as soon as a baby's born, the very first thing they do is to get it to breathe. Then they do a heel prick or heel kick test. I used to do the heel kick. There's more and more heel pricks done. The blood is rushed straight to a laboratory where the thyroid hormones, that is a thyroid reflex test or a thyroid blood test. And they determine if the baby's got enough thyroid. They have to get enough thyroid into that baby immediately if the baby's thyroid is low. So the thyroid affects you from the day you are born. It's the key hormone in your entire system that makes all your system work. In fact, when I was a young boy, I'll just tell you a little personal story. I lived in a little town in New Zealand called Taradale, and we had boardwalks and dusty streets, and we had a couple of village idiots in town. The village idiots were because their thyroid was dysfunctional. It has got a technical name. I refer to it as a village idiot, but every town in New Zealand and Australia had a couple of village idiots. They were tolerated, but that is caused, it's called cretinism, and it's caused by thyroid hormones being too low at birth. Mm-hmm. And so thyroid can affect you from birth. The next thing when it changes is when a boy or girl at about the age of 7, their hormones change. They become from a baby, or into a boy or girl, and that is when the thyroid first shows up. If you have low thyroid since birth, and of course puberty for women is a major threshold you have to cross. If your thyroid is low. As I said before, thyroid controls your estrogen and your progesterone. If your thyroid is right, you're not going to go on the roller coaster of a ride with menstrual cramps, bloating, heavy menstrual cycles lasting for more than 3 days, all those myriad of problems that a young girl faces when she first goes through puberty, and tracks her through the rest of her life. So that is, we sort of segue slightly, but that is vitally important.
Mm-hmm. Yeah, thank you for that, Dr. Turner. So, yeah, stress modulators, core hormones, and they are important right throughout your life. So, this is what today is about, is bringing the wisdom that Dr. Turner has so that you can benefit from that. And I hope that this encourages you to perhaps take some steps to have that different test to get you on a better path to health and well-being. So thank you for listening. Thank you, Dr. Turner, for being with us today. It's been great.
Thank you for inviting me along, Gary, and I enjoy sharing this with all of your patients.
Thank you. Bye for now.
Thank you.